Hello viewers, today let us see a very important lesson, that is how to control pain or how to treat pain. In this lesson we are going to see what are the characteristics of pain and what are the different methodologies of pain control, like pharmacological, surgery, then psychological treatment methods and naturopathic treatment methods, and lastly about pain clinics. To begin with, for us to go for treatment of pain, in fact most of us visit the doctor only when we feel that the pain is unbearable, and many of us associate pain with illness. If we have any problem also, if there is no pain, many of us think that if there is no pain, it means that we are almost healthy, even if there are other symptoms that indicate to us that there is something wrong with us. Even if suppose there is some new growth in the body, say a small boil is growing on the foot, many people neglect it if there is no pain. So, pain is associated with illness, but there are many colors to the pain, because pain is of varying degrees and there are several characteristics of pain. So, to go for treatment of pain, first an assessment of these characteristics have to be made. Before assessing the characteristics, let us have a look at what those characteristics are. The first characteristic is the site of pain, that is where actually is the pain located. So, basing on the site of pain, the treatment varies. If suppose the site of pain is lower back, then the treatment methodology is also going to be different than when it is if the pain is situated in the heart region. So, certainly the site of pain is an important factor to assess the kind of treatment that has to be given. If pain is perceived in the heart region, certainly one has to see the cardiologist, and the cardiologist might take it as a serious case and might immediately want you to be admitted in the hospital. Unlike when you have pain in the lower back, when simple massage techniques might be recommended, or by taking rest the pain can be relieved. So, the second characteristic for pain, as you can see on this slide, is onset, that is when did the pain start and how did it start. So, this also becomes very important, because as soon as we go to the physician complaining about pain, he asks from when are you having this pain, which gives him or her an indication regarding the present state of condition. So, onset of pain, when it has started, is another important characteristic for the kind of treatment that has to be given. If the onset is just very immediate onset, that is since half a day you are suffering from the pain, if you say that, the kind of treatment will be different from when you say you are suffering from pain from the past 1 week or 10 days. If it is from the past 1 week or 10 days, then certainly it is the time when the physician will want to use other kind of assessment techniques. If you had said the pain has just begun, then the most probably the physician will advise you to wait for some time and see how the disease will progress. So, the onset also is very important for the kind of treatment. The other important characteristic is what kind of pain is it? Is it throbbing pain, or is it just slight pricking sensation that you are having? So, depending on the kind of character of the pain, also the kind of assessment or etiology will be found out by the physician, and similarly the kind of treatment. Other important characteristic of pain is the concomitant symptoms, that is the other symptoms that are associated with pain. Are you just having pain in the stomach, or also are you feeling nauseous? Certainly we know that when nausea is also involved with stomach pain, then it is to do with some kind of stomach upset. If there is no nausea, if there is no other problems, then certainly the stomach pain will be understood in a different manner, and the kind of treatment also varies. Other characteristics of pain are the time course. Is there any pattern, that is, do you get pain more during nights, or is the pain intense during mornings? Is there no pain that you feel during the midday? So, all these indicate the pattern of pain, and also the kind of exhilarating and relieving factors. Do you feel less pain when you are resting? Do you feel more pain when you go to a cool room? So, all these, what are the other factors that either aggravate your pain or relieve the pain? That is also another characteristic of pain. And similarly, the severity of pain, is it mild or is it intense, is it unbearable? So, all these are taken into consideration before the treatment plan or program is begun. In Europe, an interesting survey has been done on pain, and they found that 1 in 4 patients feel that their physician do not know how to treat pain. And the other result of this survey, by taking huge sample, revealed that 2/3 of the patients feel that they are not given proper medication. So, this indicates that understanding pain is rather challenging even to highly talented or highly trained physicians, and many times there will be a gap between what the patient feels and understands and how the physician is treated. And many of you might also agree, if suppose we go to a physician and our pain is immediately relieved, we think that the physician is really very good. Actually, the physician might not be looking into our actual problem and trying to treat it, but if we think the pain has gone, we believe that the physician is very good. Now, the question comes, why should we treat pain? In this regard, I would like to share what 2 successful physicians have to speak about pain. Tissue damage has the potential to elicit mechanisms that can create disabling, refractory, chronic situations that may prolong and even outlast the period of healing. Hedrich and Ness had stated that controlling pain is very important because the resultant tissue damage because of pain and other psychopathological reactions that takes place within the body as a reaction to pain might be more debilitating than actual physical condition. So, treatment of pain actually is not given so much importance earlier because it is not considered as separate from illness. So, but today, because of all these findings and characteristics and theories of pain, the importance is given to pain. Pain today is considered as a condition by itself because there are so many reactions that take place within the body as a response to pain. Earlier, they used to think that these reactions are as a result or as a reaction to the tissue damage or injury. But today, the responses for tissue damage per se and the reaction of pain are separately understood, and they had health psychologists and other physicians and biologists started understanding the importance of considering pain as a separate condition. So, today pain is considered as a separate condition and is also treated likewise. So, we might see, if we see the prescription of any physician, you will see several medications that are prescribed, and some of these medications might be helping in the actual repair of the organ that is malfunctioning, and there will be also prescriptions given just to overcome or deal with pain. Before going on to the actual treatment methods for pain, let us see how pain is assessed. The first type of assessment is pain intensity. Pain intensity is today assessed by using a numerical rating scale from 0 to 10. So, if 0 means there is no pain and 10 means the pain is very intense and almost unbearable pain. So, along this rating scale, the patient is asked to rate the level or intensity of pain. So, if the patient rates something like 2 or 3, it indicates that there is only mild pain which is bearable by the patient, but if something like 6 or 7 or more is ticked by the patient, it means there is severe pain. The second kind of assessment that physicians take is make a description of the pain, like is it hot, is it burning, is it like sharp stabbing kind of pain, or is it cold, and is the pain brought by light touch also. So, the kind of pain, like when this pain is experienced, is also assessed. Apart from that, a neurological examination is also made to identify various signs like allodynia, which means pain produced by normally non-painful stimulus. Actually, it is non-painful for others, but for these patients, they feel pain. And also other neurological conditions like hyperalgesia, which means increased response to a normally painful stimulus, and hyperpathia, which is abnormally painful reaction to a stimulus, especially a repetitive stimulus, as well as an increased threshold. For example, people suffering from hyperpathia might be having such reactions, for example, for a loud noise. They might be overreacting to the noise which is repeated, and also there will be other conditions that have to be assessed before the pain management is started. Apart from that, other influences or other disruptions that had happened as a result of pain are also assessed, like are there any sleep disturbances, is there any change in the appetite, or is the person's daily routine disrupted. A person with mild pain can go on with normal activities of their life, but whereas person with severe pain, for them many of their daily routines are disrupted, and sometimes they might be just have to spend time on the bed. When a person is suffering from pain, apart from the negative experience that the person has to undergo, other factors that are going to be affected, like the person's work might be disrupted, the person's family relationships get strained, if especially if the person is suffering from pain for a long period of time, because many times what this person has to do have to be done by the other people in the family. So, family also gets taxed and strained because this person is suffering from pain for a long time. And also monetary factors are also involved, because assessment of pain and treatment of pain involves lot of expenses. So, financially also there might be a strain on the family. By itself has other effects like educationally, financially, and even family wise, there are so many problems that keep coming up because of untreated or long durations of pain. And during pain, the person cannot concentrate on other activities, and so all the things needs to be rescheduled and replanned. Let us see what are the factors that complicate pain. If suppose this person has to undergo a long duration treatment, but the person is not financially sound, then that is going to be further complicating his problem. If for example this person suffering from pain is a drug addict or is an alcoholic, then taking drugs and being an alcoholic is going to further worsen the condition of pain. And other influential factors or other aggravating factors are not having a secure family life. It is only the family and close friends who will give lot of support during times of need, and suffering from pain needs lot of attention and support from others. So, if this patient is not having a strong family tie-up, then certainly this is going to worsen his condition. So, other factors like having the right kind of resources for pain relief are also another factor that is going to complicate pain. Before treatment of pain begins, it is suggested that a kind of education is given to the patient regarding what to expect and how the pain is going to progress, which is called as pain education. So, many times the patients because they have fear that this pain is going to be staying with them for a long period of time, that fear and anxiety component further worsens the condition. So, it is better by using some trajectories, the person who is treating pain explains to the patient regarding how many days the pain might be there or how intense the pain is going to be there, so that the pain does not over imagine or listening to others talking about pain in a negative way, the person's perceptions are not affected. So, treatment of pain begins with education of the patient. And also there are many patients because they do not understand properly about severity of pain, they tend to develop anxiety and tension. So, the physician, when they explain what to expect and what not to expect, that is when the patient can take up the treatment program with an open mind. And also many patients they feel that taking these medicines might result in addiction to the medication, which is of course not false, but the physician can explain what dose will result in this kind of problem or the length of treatment will result in this problem, and also the kind of side effects. Now, many patients do not take medicines on time because they fear the side effects. So, since there are many side effects for the prescriptions that physicians give, it is important that the physician openly discuss with the patient what kind of side effects are expected, and also many times the physicians give medicines for this side effect also. Now, let us see what are the various treatment programs that are available for treating pain. In this, there are various types of treatment methods. One is physical and second one is psychological. In the physical method of treatment of pain, again it is divided into two types. One is surgical and non-surgical. In non-surgical comes pharmacological and naturopathic kind of a treatment. Now, coming to surgical treatments. Surgical treatments are done by neural blockade, surgical lesions. That is, surgically they find that nerve which is actually affected and which is causing pain, and they try to disconnect the connection between the particular nerve, which is usually called the nociceptor neuron, and when this surgical lesion is created, is done, that is a cut is made, then the signals of pain cannot reach via the spinal cord to the brain centers. So, then even if the person has that problem, still because of this cut the person is not experiencing pain. Of course, using surgical method has its own limitations, because once the brain structures and other structures are opened up, then the lot of risk is involved. Sometimes it might be helpful, but other times some other parts of the body or brain will take up that function and they will be only temporary relief. Because without perception of pain, the body is exposed to all kinds of harmful events. So, that is why surgical procedures have a lot of risk involved, because some other part might take up this function and it gives only temporary relief and the patient might start perceiving pain again. So, this surgical method is adopted only in a very severe case when the pain is unbearable by the patient and there is no other means through which pain can be controlled or modulated. Coming to non-surgical procedures, that is the pharmacological procedures where certain drugs are given to the patient to overcome pain. Coming to other non-surgical procedures, the naturopathic technique, massage is one technique that is suggested, because when there is physical manipulation of the site of injury or pain, then other cells get activated and they result in closing of the gate. In the gate theory, we have seen how some factors open the gate and some factors close the gate. So, the gate control theory clearly indicates that any kind of physiological treatments like massage results in closing of the gate, and so there is a relieving of pain by the patient. Other naturopathic treatments or other treatment methodologies include acupuncture, where specific points in the body are stimulated. And apart from this, any kind of heat or cold massages are also recommended in this kind of non-surgical procedure. Now, let us go into the psychological treatment methodologies. Now, we have seen that psychological factors also, many factors help in either closing the gates or opening the gates. Like when there is anxiety, depression, the gates open. So, psychological counseling can help the patient overcome their anxiety and depression and teach them positive strategies so that the gate gets closed. Apart from that, biofeedback techniques and also relaxation techniques are helpful in relieving of pain.